I'm looking up at you, just saying.
Well, hello, America. We are live. It's a Health Tech Talk Show. It is December 5th. Holy shit. Here we are. Lisa's back from somewhere, as usual.
Your sound is terrible. I don't know what's going on.
Jesus Christ. I don't think that's me. I think I'm doing fine today. Anyway, here we are. So we have a special guest. Melissa, would you introduce Jose to our audience before we send him to the back?
Jose Arrieta is from Imagineeer, brought to us by Wellink, and an amazing individual who will be speaking to us about all the things that he does.
Awesome. Amazing.
Like that one? That was fast.
That was great. That was great. I'm just making sure Lisa's not right and my headset is on the right one. Okay, great. Here we go.
Mm-hmm.
Cool. Okay. Well, all right, Jose, sorry. This is totally normal for us. You're going to the backstage. Sorry. And Lisa, what's going on?
What isn't going on? I mean, listen, December is always hard. The holidays are always hard. And now everyone's like, oh shit, there's like 3 weeks left in the year. We have to do everything right now.
Right?
And that's always exhausting.
Yeah, it's not great. The good thing is this is the only week when people seem to actually work, though.
I hope they stop working so I can catch up. Like, please, everyone, stop working. So don't send me any more emails. I have like 5,000 to go through. So,
no, that's the thing. People, they hustle hard. Thanksgiving happens. Everybody takes off that week-ish. Jesus. And then this week is like, everybody's like, okay, we got to get everything done. And then like, and then
everybody's checking out till January 2nd.
Right. And then no one comes back. So that's my great hope.
I'll schedule it for January 2nd then, or January 5th, more likely.
But you know what will be interesting, y'all, is like in years past, the whole federal government kind of shuts down like now, right? And like everybody takes their vacation that they've saved up. Everybody's gone. Do we think that will happen this year? Or do you think people are going to be burning the end of year oil?
I don't think it's going to happen this year.
No.
Yeah. I guess whoever's left is probably hustling.
Yeah. Who's going to do that?
For fear of, not being here anymore.
I don't know. Well, anyway. Okay, Melissa, what do you have to tell us before we throw you in the back?
Nothing much. Just I need sponsors, guys. Call me, text me, email me, DM me, all of the ways to get in contact with me. I will repost. Just remember, I need your help. We need some assistance with our tech. Obviously, you heard that a second ago, and Kat's mom is not available today, and I would really appreciate it. So
please. She can only do so much.
Okay. That's where we're at. So.
That's right.
Okay. All right. So we've got like a real deck today. All right, let's send Melissa away. What we got going on? So Lisa, tell everybody where you were at this week.
God, so this was actually very sad for me. I was at a conference and none of my friends were there. It was so sad.
Yeah, it was dumb.
Conferences are way worse when your friends aren't there. We can just tell you that one. That's just a wow. I was at AWS Reinvent. And I will say, I actually did have a pretty good time. But it was a very different experience because it was a conference where none of my friends showed up. And so it was like, okay, I guess I have to meet new people. Weird. Why would you do that? So I did. And there were some nice people, but also just like, what the hell? On the other side, I was in bed before 10 p.m. every night and actually sleeping. So positive news as well.
Okay. That literally never happens when you're at a conference. So good job.
Nope. Yeah.
A plus for you. Do you recommend this conference to our loyal fans?
Honestly, I mean, obviously, AWS Reinvent is very much about education for folks who are technical, working on cloud stuff, and there's a ton of that. It's also just so big that it's kind of crazy. But there was some cool stuff. I mean, they were definitely spending on spending on some of the social things that were kind of cool. I had the best sea bass I've had in my life, which was kind of amazing at an event there. So good job, Amazon. Appreciate you. I think if you're in the go-to-market business development side and you have a bunch of cloud partners, you could go there. But it's definitely very much meant to be a technical education conference at a massive scale.
Like a nerd, a technical massive nerd conference.
Yeah. Totally.
In our favorite place, the Venetian.
Yeah, the place that I have been so many times this year, I have truly lost count. It is very upsetting. What I will say as well, if you are a healthcare nerd conference person, I thought that health was big. The HLTH conference was big. But there are parts of the Venetian Expo that I had never seen opened up before, like the
Hmm.
basement where they have all the food. I mean, health is like 10 to 15,000 attendees. AWS Reinvent is like 70,000
That's
attendees.
wild. Even
Okay,
HIMSS in its height
it's
was
crazy. No,
like
this is
40,
huge.
50. Yeah.
This is bigger than that. Like they take over all the hotels. The basement of the Venetian Expo is like a massive like food hall. Like if you've been there for a healthcare nerd conference, you have not seen those corners of the actual expo.
Hmm.
That like it is huge. And I just had to say like, wow. It's a lot of spending. It's a lot of money that's going to those kind of things. Wow.
Yeah. Yeah.
Big wow.
Well, good to know. So, in
Yeah.
other wow news, today there was some amazing
Ay,
news
ay,
coming out of the
ay.
CDC's ACIP crew, and they were voting. Apparently, they tried to do this earlier, vote on the Hep B vaccine, saying that it is not required. Not that it ever was required, but recommended at birth. And as of today, they have ACIP has voted that it is no longer recommended at birth, but should be recommended sometimes after 2 months of life. So our dear friend Senator Cassidy is super pissed about this. He actually said this in
Should
his
be.
most recent the Senate help hearing with Kennedy a few months ago, and said, "Hey, he's like a liver doctor, y'all. He's a hepatologist, and he was like, I have seen this change people's lives, and this is bullshit." And so he's sad about it. Also, I will say, so then there was, later on in this article, it says that, so here's the thing. I have birthed 2 children, one at a real normal American hospital where they do a lot of normal American stuff, and one at like a birthing center in a freaking water kiddie pool. And both times they said to me, "Do you want these services for your child? Do you want your child to get the vitamin K shot? Do you want your child to get the Hep B vaccine?" No one said it. No, they didn't just take my babies away and do these things.
Inject them.
They still ask you. And I don't totally remember because I was in an unmedicated labor in a kiddie pool, but I'm
Sure.
pretty sure I still signed something with like a wet hand and pen that said yes. So like, I don't know what people think happens here, that they take your baby away and just shoot
Yeah,
them up.
dude. They
But
don't
like
do that.
you as a parent, as a guardian to these little creatures, you still consent to everything. So a lot of this I just think is like complete bullshit. Like no one is stealing your baby away and doing
They're
this stuff.
wasting so much time and energy to like have these like dramatic fights about this. Holy crap, man.
is so
Nobody
dumb.
is forced to do this. And the idea that you are, and then when you add all this doubt and you like,
Like,
I
is it
can't.
just a show? Because it
can't.
says here, okay, so the Hep B
can't.
vaccination for newborns is to be left to individual-based decision-making, which members of the panel noted already occurs. So we still spent how much time bitching about this? And then Cassidy, of course, is like, this is absolute bullshit. And he said the hepatitis B vaccine is safe and effective. The birth dose is a recommendation. It has never been a mandate.
Jesus.
Like,
Yeah.
I'm just like, what on earth is going on? So like, I don't know. We're going to talk about trust a little later, like we always do.
Yeah,
Like, I feel
yeah.
like we talk, like, basically what this is telling me, y'all, is like the CDC is dead. Like no one liked it before and no one likes it now. And no, like there is no way you can salvage this organization. Like
Bad news.
If they wanted to destroy it, like congratulations, you have done so.
And it might have been the goal. Might have been the goal.
Maybe. But if the intent was to have an organization that you trusted, like that wasn't the intent. A lot of times I get the intent wrong here. But yeah, I mean, Yeah. Because again, like as someone who, like I just said, I gave birth in a freaking kiddie pool, right? Like I'm pretty freaking crunchy. I am pro-vaccine, but I am pro-freedom in all things. You already have the freedom to say you do not want vaccines for your child or yourself.
Totally.
So like, I'm just having a lot of problems. Okay.
Yep,
but in
yep,
good
yep.
news, Lisa, why don't you share some good news for America today?
Good news. So we've talked
Women.
before about teal health, like self-collection thing for HPV testing for the pap smear. And like now it's moved forward, not just beyond like basic like FDA approval where they were like, yeah, this is good, but also the American Cancer Society is endorsing it and updating their cervical cancer screening guidelines. So like big win for, innovation in the space that has been kind of allergic to innovation for a while. We a lot of people, including the Teal Health folks, others have been like trying to do some innovation in women's health from a screening perspective, from a medical device perspective, from a pharmaceutical and biologic perspective. And I think we're finally starting to see some of that those things coming to light and actually making their way beyond just like the first steps of new development innovation. So like just glad to see some progress. I realized that we were making like backsliding in things like vaccines and in public health in general, but like there is still this push to innovation. Like the only thing left, as far as I can tell, that makes American healthcare generally and medical and scientific research great is that we are on the innovative, like on the tip of the spear there. So like this is great. Good job, everyone.
Yeah,
Big
good job,
support.
America.
Good job.
A+. You did a good
This
thing
is your
here.
only A+ of the year, as far as I can tell.
Yeah, especially in women's health. Like,
That's
way
right.
to go.
That's right.
Yeah, it's interesting too here. We have to see, because I know when we talked to the Teal Health people at JPM, almost a year ago, one of the barriers to going to market for them was that they would have to upset the traditional reimbursement protocol for OBs or OBGYNs. And so, how is this going to be reimbursed? Is this something you can do via telehealth now, right? You don't have to go in the office and have someone put something cold up your lady parts, right? Like, I don't know. I'd be interested to see that just from a commercial perspective. I think it's super interesting.
Same. We should have them back on.
Cool. We totally should. We should call them.
Yeah.
Speaking of trust, Steve Posnack, he has a very long title these days, I think, right? It's Principal Deputy something National Coordinator of ASTP person.
He's the Principal Deputy Assistant Secretary for Technology Policy.
That's what I'm
and
talking
I
about.
think the Principal Deputy National Coordinator, but I could be wrong. That's my best guess.
I just love a lot of titles. So good for this guy. Wrote a little piece this week on trust in TEFCA. And I think this is something that no one is going to dispute. The problem isn't tech, it's trust. I also think it's commercial model, but
Sure.
Yeah, I think we have a lot of people who don't trust how things are going. I do think the TEFCA crowd is doing a better job. I think eHealth Exchange went first by changing up some stuff for transparency. At least I think they were first. And then I think, I don't know. Everybody's run by Sequoia, so it's hard for me to keep straight who actually did what. But sounds like they made some changes for transparency. I will add again, trust and transparency are different things, but transparency can be substituted in the absence of trust. So I'm here for all those things. But yeah, I think also like TEFCA's only going to work when somebody pays for it. Like whenever it becomes a commercially viable model, which can't, because someone tell me how it can. And then if the government decides to pay for it. So someone should write a blog post about that too. How is this going to be a viable model long-term? Someone tell me.
There's really not a plan, as you know.
Yeah.
Do the right thing.
Other than like,
That's the plan.
other than the large EHRs just taking it over and doing it as a cost of business, which cuts out any sort of smaller player. Like, I guess that's a commercial model. I don't know.
I guess.
Whatever. Anyway, interesting stuff. Other ASTP-ish stuff. I mean, this is like HHS wide, but Jeff Smith is an ASTP guy as far as I remember. And HHS released an AI strategy this week. Did you read it?
I have not read it yet, unfortunately, for me and everyone else.
So, I mean, it's unfortunate for me because I had to actually kind of read it.
Ew.
That's
weird.
I was like trying to figure some shit out. I guess we'll just see what happens.
Yeah. Oh, Ryan Dempsey called out here. What's up, Ryan?
Ryan Dempsey's doing some stuff. Yeah.
Shoot.
I mean, I think there's a lot there, right? And it's like, a lot of this stuff, it's like, okay, how do you actually make that happen? Like, again, we were talking about public trust, right? Like, there's a lot of like right now, there's not a lot of public trust generally.
Well, like it's also easy. It's also easy to easy-ish to write a new strategy, but like, what does this mean? Like, what are they doing here? What's the goal? We've had multiple HHS AI strategies before over the years. So what's different about this one and the last one? That's what I should ask AI to tell me. Let's see if AI will tell me like what is the difference between this and the last one.
Yeah, ask AI that. I'll also say with new things, and I know AI isn't necessarily new, but like the wave is new. Sometimes it isn't best to take our great federal government, which is a massive, massive thing, and say, you know what, we're going to be first to market. Like, I kind of think maybe the government should be second mouse gets the cheese in their strategy with AI. Like, let's let the private sector fuck everything up, see what works, and then we'll adopt it. So I don't know, whatever. Like, as far as everything else goes, like the fact that the CDC is like absolutely abolished, like, I mean, whatever, they can do this. It's great. Maybe it'll work.
Maybe.
Lisa, did AI tell you what the difference is?
Not yet. I gotta spend some more time making sure I have the right source materials.
Oh, here's some great American news. Grace Vinton, who we like a lot, she is now a fierce woman of influence. 2025. The piece about her actually highlights a lot of her patient advocacy work, which is super cool.
Yeah.
So she is someone who has struggled with, I think, autoimmune issues, difficult to diagnose, resulted in her being real sick. She's also a world famous PR girl, but I think that's subordinate here to her coolness that she does.
Well, I think that probably makes her a better patient advocate if you're asking me, but you know.
Yeah. I am. I'm always asking you. So go Grace. You're the best. Congratulations. I also was like, did she change jobs? And then this is the company that acquired her other company. So
yeah, I think there's some naming of things. She did not change jobs.
Some naming things. But anyway, congratulations, Grace. You're the best. This is it's weird how I cut this year, but this was Sachin Jain's healthcare predictions for 2026.
He's really trying to get ahead of everyone else. Is really what it comes down to. He was early on that one. So yeah, if you have some predictions, feel free to start sending those our way. Sachin Jain was, early there. Let me go back and look at this because I don't remember like what my thoughts were on his list, except for being like, wow, he's so early.
Healthcare's AI revolution really hit speed bumps. I mean, agree. Second mouse gets the cheese. Maha goes mainstream.
Yeah. Oh, I remember that one. I was like, okay, all right, I got you. Yeah. Nice.
Yeah. The GLP-1 revolution will continue.
Yep. MA. This one's very self-serving since he runs an MA company. Medicare Advantage will remain popular despite its haters. I was like, okay, sure.
I like how he made it. He made it number 4 though, to like.
It's not number 1. It's not number 1. It's not number 1. Patient and clinician discontent will boil over.
Right. We just had some real bad shit happen this year and last year. So I think, done. The small guys will continue. These are not great predictions. Where are the hot takes? Where are the hot takes? Did a PR firm write this? Pharma pricing and PBMs were made in the crosshairs. Like, no shit. Lots of legislative activity, but little action. Ooh, that's some shade. Well, legislative stuff, I mean, that's like Congress shit. So
that's also a pretty easy prediction because that's what has been the case for a long time. What would be amazing, Congress, is if you actually pass some laws like now.
Yeah. Most changes in healthcare will come from attempt at regulatory fixes from CMS Administrator Amendment Oz. Health equity makes a modest comeback.
I also read this, Catherine. There was something about there's a test of GLP-1s for cats.
Oh, I saw that.
I was like, what the hell is going on?
My cat needs that, right? Because my cat is a very active cat. He is indoor, outdoor, but he eats all of the neighbors' treats. Just can't help himself. So I don't know.
I get it though. I get it. I understand Hawthorne. He's fine. He's fine.
He likes to eat. He likes to eat. Oh, this was the best. So Lisa posted this on our little Slack channel for the Health Tech Talk Show. San Francisco sues ultra processed food companies. Oh my gosh! Please say the quote from the attorney guy.
Oh, what did he say? He basically was like even a stop clock is right twice a day. He's like, a lot of Maha stuff is like basically not real, but this one, Secretary Kennedy is absolutely right.
This is ultra processed food. Here's what it said. He stressed that he does not agree with Mr. Kennedy on other health topics, including vaccine skepticism, but said that the science is indisputable when it comes to ultra processed foods. And then many of the perspectives of this administration are not backed by science, but this is different. Even a broken clock is right twice a day.
That's right. That's right. David Chu. Amazing. Amazing. But yeah, I mean, listen, like, I support, pragmatic government here. And he's like, you know what? Like, if this is the movement, let's do it. Like, let's fucking go. He's like,
Yeah. Let's
LFG,
sue.
let's sue them. So this is great because, here's the thing, right? Like, state and local governments are absolutely left holding the bag when it comes to decisions that, big corporations make about, what kind of food and drink they're going to be selling to people, residents, citizens, consumers in those states and governments. You know who pays for that? We do. And there is some trash out there. I certainly eat it, just to be clear. I love, I do not eat, what is it? What is the Flamin' Hot Cheetos? But that's the example of the kind of food that is
Flamin'
so
Hot
incredibly
Cheetos.
bad for you. And you know what? People love it because it's filled with addictive things and it makes you real, real, real unhealthy.
Okay, quick detour on the Flamin' Hot Cheetos. So my younger son came
I think
home.
I've actually ever had a Flaming Hot Cheeto.
And
but keep
okay,
going.
and I don't like they can buy these things at school, right?
Yeah,
and so
crazy,
he came home with
crazy.
what looked like serious chapped lips, like up here. And I
Oh,
was like, oh my
God.
gosh. And he was like, I'm fine. Because they don't want to tell me that they eat this crap,
Sure,
right?
sure.
What
Yeah.
they buy. I think I can do some controls on their lunch card or something. Anyway, and so I'm like, my older son, I was like, hey, can I have the chapstick? Is it in your room? And he's like, his lips aren't chapped. He had Flaming Hot Cheetos. It's like burning the skin on his lips.
Ouch.
Oh my gosh. Anyway, yeah. So that's
horrible.
I got a mom hard on that and figure it out. But anyway, go San Francisco. Proud of you on this one.
Yeah.
Oh, this is just a cool thing you noted. Cool, but like interesting at the same time, like the Trump accounts.
Well, so the Trump accounts are actually a really fantastic idea. That was not invented by, President Trump or the folks working on this. Obviously, the idea of like baby bonds, where you put a certain amount of money in an account for every baby who's born in your country or in your state or whatever, and that money is invested over time and accrues. It's one of the more like innovative ways to like build wealth across your society. So it's been floating around the like economic development community for a long time across different countries. So like, cool. It's something interesting that we are doing finally, and I love it. The Dell family like also donated some money for this too. There was an analysis afterwards being like, yo, if they had just paid taxes, blah, 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 the same story you would hear. Normally, again, I support philanthropists should give all their money to everybody. Like, please do that. We love philanthropy. Give us your money. Give the Zoria Foundation shout out, by the way.
I got to
like,
don't worry.
Yeah. Okay. Yeah. But like this is fine. Yes. Let's definitely let's please like billionaires give your money to these really important social programs. I approve.
Yeah.
Please do
billionaires do stuff. Self-directed stuff is cool. A+.
Cool.
Okay. All right. So big news this week in our little baby industry is that CMMI released the ACCESS model, advancing chronic care with effective, scalable solutions. And there was an in-person event yesterday, which seems cool. Neither of us got to go. Lisa was in the Amazon thing, and then, like, honestly, I was just here in my house.
I was invited, just to be clear,
but we got a lot of good tweets.
Make it. I could not make it. I sent someone from Innovator, Sean Hogan, a wonderful leader, and he went in person and got to experience it. I was watching it on the YouTube. This is a big deal, right? This is trying to bring these like tech-enabled chronic care solutions to Medicare beneficiaries directly. And it's also importantly going to be paying on outcomes for health improvement in a particular couple of areas around like cardiac health, diabetes, behavioral health, right? So these technology enabled care companies are going to be able to be aligned with a beneficiary. A beneficiary is going to choose to work with them, and they're going to get paid by Medicare based on actually improving those people's health outcomes. A lot of details still to be filled out, but like it's a big deal. This kind of thing has been available to some extent in Medicare Advantage. So, Medicare plans actually doing this because they get more flexibility, and also in accountable care organizations have been doing this work for a while. But like this is a big effort to change this trajectory and bring sort of better technology to improving chronic care in the US. So pretty cool.
Yeah, definitely a boon to tech companies. I sent
For
Nick
sure.
Cheney on my team here, and she's handles most of our federal stuff, and also like was there, so she like knows a lot. What she said was that hours. Oh, did I lose you? There we are. Yeah, she said it was only a couple hours, but she said a lot of like very large companies were there, and people were actually really excited about it. But she said the thing that they were most excited about. Again, she was talking about like some very large health tech companies in our space. They were most excited about, that's funny too. We'll say that later. The FDA's Tempo pilot, which is going to help fast track a lot of device stuff that they don't have to necessarily go through pre-market authorization. They can be used within this model without that, which is like actually a huge deal. I think I saw on Health Tech Nerds, I think, I forgot his name, but he works with Brendan at HDI. Or HTT, HTD.
Brad?
No, I don't know. He's all over Health Tech Nerds. Anyway, I think Brendan brought him around, but he called it the FDA side quest. But she said everybody was like, that is actually incredible. Like this is like a huge deal, and will be amazing for a lot of companies. So I am totally into that. Biggest criticism I heard was that, like much along the lines of Travis from Aledade, there are no numbers yet. So we don't know.
Yeah, there are no numbers yet. We need to know that. They haven't made the actual application available. They definitely got ahead of themselves a little bit here, trying to build, excitement and FOMO, I think, which is, okay. The other big question is over 50% of Medicare beneficiaries are already in some kind of accountable care relationship. And so the big question is always with the kind of stuff is like, how are there overlaps with existing programs? And it matters for things like attribution and payment and benchmarking. And so, the big question is going to be, how do we make sure this actually improves care and ultimately reduces costs? And the risk, of course, with this is always going to be, is this just adding to the cost of care? TBD, we'll find out.
Yeah, TBD. I mean, I think, devil's in the details. I think generally people are excited. I don't know if it's a great thing that the health technology industry just got like a massive, high five at the very least, potentially handout. But I'm also not mad about it because this is like where I work. So like,
well, by the way, there's also a rural care component too. There's actually going to be allegedly a plus up payment for rural care stuff. So they want to make this also loop into the rural health transformation work too.
Yeah.
So again, on the one hand, like, I understand the frustration and the concerns around like, are we giving away money to the tech companies? But I get it. I really do get it, even though I am incentivized not to get it. I do get it. But like what I will say is like, here's the reality. There genuinely are not enough doctors or clinicians in the US. It's not going to happen in time for us to reverse like really significant chronic care issues across the country, worse in rural settings, right? So like, what are we going to do? Do you have another solution that is not like hybrid virtual care using better technology, right? Like please tell me the other solutions like that we can implement in the next 3 years, because I don't know any of them.
Yeah, we could just reimburse clinicians more.
No, we don't have enough. We don't.
We could keep them happy and healthy and productive in our American workforce by
sure. We can and should do that. We literally keep in mind again.
There are lots of options in our technology. Lisa, which one was the Democrat?
False,
Jesus Christ!
False.
What happened?
Yeah, you keep telling me about labor rights. I want to hear more. I want to hear you making the labor rights argument.
How many surveys do we see that like 50% of nurses drop out of the workforce every year because they're not paid?
Come on, girl.
And like,
No, but actually, those nurses will be hired and employed by these virtual care companies because it's not a technology only solution. Anyway, second thing is, cool, except for keep in mind that we pay doctors and nurses more than like any other comparable country. So just to be clear, I am very sympathetic. I understand that doctors, nurses don't make as much money as they want to. The reality is, compared to other countries, we pay a shit ton more. We really do.
We pay a
Sorry,
ton more. They have to
unpopular.
pay hundreds of thousands of dollars for
Don't
their
cancel me, unpopular.
unprofessional degrees, since nurses are no longer
Is
professionals.
today
So
opposite day? I don't know what's
just
going
saying,
on.
no,
Why am I the
saying,
Republican today? What's happening?
what? Tech is not going to save American healthcare. It's just not. But anyway, obviously, I'm here for this because
Today is opposite
I
day.
will make more money. Thank you, CMMI. Thank you, the Trump administration. I am excited. I'm just saying, I don't actually think this is going to like save
Today is
America.
opposite day.
But
I love it.
No. So there's a ton about home-based health, which is interesting because we just saw that RPM, United Healthcare, is no longer going to reimburse that for a number of different cases, right? A lot of things has happened this year that
It's
made me
like
think,
CMS doing the opposite of United Healthcare is
CMS is
interesting.
opposite
Like,
day.
what?
Yeah.
Yeah.
So they're doing that. I think even talk about hospital at home, which objectively has been kind of a fail in the market commercially, just due to lack of incentive. So maybe that's a thing that'll take off. Maybe it's not, but that's very exciting. And then I did hear hot goss from an investor. Maybe this isn't hot goss, is that apparently Sword and Hinge lobbied together to make this happen.
Absolutely they did. And they were like, we will be applying. Like
There we go.
they're like, we are on it right now. Yeah. Sword and
Again,
Hinge.
I am here
Oh,
for it.
MSK. I keep forgetting the other disease area. It's obviously MSK. One of the
Yeah.
categories in Access is MSK, musculoskeletal. And so Hinge and Sword and all those guys are like, yep.
Yeah.
I
Call us.
believe it.
We're here. Yeah. Again, God bless America, where we have legalized corruption and it is called
Yikes.
lobbying. God bless
Yikes.
America. Anyway,
Big
but I'm
yikes.
excited. Like I said, we're all going to make money off this. That's great.
Okay.
Okay. I don't know if everybody remembers, but the government shut down for a really long time. And it turns out we had many unresolved issues. And it appears it is still very difficult for our great Congress to execute on a healthcare plan. So TBD, maybe we'll be shut down again.
Sorry, what plan are we talking about? Do you have any details about this plan? What is the actual plan? What are we going to do?
Lisa, look, the speaker said he expects to release a framework next week. Then we will find out.
Me too. I have to write it first, though. I have to think of it. I have to write it. I have to negotiate it.
Yeah, because are we going to have the Trump freedom accounts or whatever they're called? Are we going to have exchange subsidies? Like, what is even happening? Are we just going to have no insurance?
No. Yeah,
none.
We're going to have no insurance.
Are we going to abolish health insurance in America?
Yikes.
I think all those things are on the table, and I am excited to find out.
Cool.
Yep. See what happens.
Let's see.
Maybe they'll weaponize the airlines against the American public again so that the Congress people do stuff. Okay. An amazing good news. So Lisa and I, Lisa's on the board of Zori Foundation, and we had our Giving Tuesday fundraiser. Yay! We thought we were only raised $48,000, and we thought we were going to have to struggle to get that. That's 4 full year grants for moms working in healthcare roles, childcare, blah, blah, blah. And we ended up raising, I think right now it's over 84,000. People keep donating, which is super cool. So that's amazing. That is, I believe we are now at 7 full year grants, in addition to the 6 that we raised earlier.
It's so cool. Like, the response was so awesome. Just thank you to everybody who gave, everybody who shared. Really awesome. And yes, like, the numbers are relatively small now, but like, the fact that we're going to be able to give full year childcare grants to 7+ moms is like really incredible. When you think about, I was just dissing people working in healthcare and saying they earn too much money. Well, the women who we are giving money to here do not earn too much money. They are medical assistants, they are nurses, they are LPNs, they are care coordinators. These are not highly paid professionals, everyone. Exactly. So it's opposite day. Listen, these are people who are like the backbone of the healthcare workforce. They do not make huge salaries. They are providing like hands-on care to people. This is really the kind of people who need your help, and they are taking care of your parents. They are out there doing the work that nobody else really wants to do, the hands-on, unglamorous work, and not well paid. So thank you so much for everybody who helped. Right. And please consider giving if you're hearing this for the first time. Emma is putting comments in the chat here. So yeah, we would love your help.
We will still take your money.
Yeah, we will still take your money all the
Like
time.
we will still do it. And like, again,
That's right.
100% of our community donations go directly back out to moms working in healthcare roles with childcare
Yep.
grants. We do not take cuts of anything. And so, yeah, so like these, these numbers aren't massive. Like I wish there were a few more zeros behind them, but now in total, from our August fundraiser and this one, we'll be able to do fund childcare for a full year for 13 moms in different healthcare settings across the country, which is super cool. So, maybe one day that'll be 130, and then maybe it'll be like 1,300, whatever the words are. Yeah.
Maybe Michael and Susan Dell will consider giving their money to Zoria
maybe they'll
instead.
be like,
What's up?
These girls are doing stuff. Yeah. So and despite Lisa turning into a cold heart of a capitalist today and me turning into a Care Bear socialist or whatever we're calling it. These moms don't make a lot of money and they work in pretty intense clinical settings, and most of them are looking at getting into higher educating themselves further if they aren't already. Most of them make under $45,000 a year and are working in community health centers and things like that. So thanks to all of you who helped us out. You're the best.
Yeah, for real.
All right. I think we're done with our slides. What else? Did we miss any other news?
Probably, but you know what? This is not a real news show, so who cares?
It's not. Now time for our special guest who we have teed up so well on our fake news show. Jose, what the heck? So you worked at the great federal government. Tell us about it. Oh my God, what happened? Did you love it? Was it the worst?
I did. You guys are absolutely hilarious.
Thank you.
Thank you. We think so too.
That was incredible. Yeah, I posted on LinkedIn and I asked, I think you should invite Kevin Duvall, Dr. Tom Keene, Amy Gleason.
They're like all our friends.
And Nicole Kleinstewart come on the show.
Absolutely. So Tom Keene, we have been harassing him by email for the last couple of years here.
I'll call him today and I will see if I can get him on.
Oh, you don't have to call him. He knows us really well.
No. We literally, so not only have we been harassing him by email, I think the other day, Kat wrote him an email and said that we would take over if he was going on vacation anytime soon. And he indicated that we were to report to the office on Monday. We did not. So I think it's okay. But we are constantly harassing Dr. Keene.
It was bad timing. It was the week of Thanksgiving. Like we just didn't show up. We didn't go. We didn't do it.
Anytime I introduce Tom Keene to somebody, I say, he's the type of guy that you would expect to find a dead body in the basement. And when you look down there isn't one, but then you realize there's a subfloor. And under the subfloor is where you find the dead.
Well, don't say too much crazy shit because he tells us he listens to this show every Sunday.
He's watching
long runs. Yeah, I don't think he watches it live, but
he's listening.
And I will say, like, he actually does tell us things in response to the random shit we say about him. So don't say anything.
We think
he
awful. Actually listens. Thanks, Tom.
Yeah.
Wow.
Yeah. Amy Gleason's been on the show. She's the best.
Oh wow. Nicole Kleinstewart.
I don't think
but I know that she and but I know you're talking about here. So let's get them all on the show.
Yeah, you have to be comfortable with like this to be on our show, so like it cuts out a lot of people.
Your fluidity in conversation, which is really interesting. Yeah, you guys. But no, I did work in the federal government. It wasn't as entertaining as the first 30 minutes of this show, which I just watched for the first time. That's for sure.
Well, good to hear it. So what are you even doing these days? I was like looking up your startup. It's got like 3 E's in it. I'm into it because my company has 3 N's in it. So
I just used 3 E's because I didn't want to get sued by Disney for using their name. And when I looked it up, I realized there's actually a company called Imagineeer, but it's not Disney. It's an organization that owns apartment complexes in New York City, which was a little weird to actually find that. The company was really just founded so that I would have something to do. When I resigned from government, I didn't necessarily have a plan or a job, and I wasn't actually planning on resigning. And so I registered a company, and that was 6 years ago. And we've been doing lots of cool stuff over that period of time. I like to tell people that I'm unemployed and that I, kind of bump into things every once in a while, and that's how I keep myself engaged. But anything from evaluating, quantum AI and cyber technologies to rebuilding infrastructures and large agencies or public sector corporations so that they can prepare themselves for AI. I've done lots of different kind of things over the last 6 years. I've meandered through a dark room with my eyes closed and bumped into walls, but somehow haven't like fallen off the balcony or are going broke in the process.
That's fantastic news. Many people go broke in the process. So you are winning, my friend. Hey,
Yep.
What do you think of the HHS AI strategy?
You know, it's interesting. I think, look, if you think about HHS as an organization, what are its issues from an AI perspective, like implementing AI? Versus talking about their strategy, let's deconstruct their issues. One, they're funded at the program level. Two, those programs build integrations to actually receive data. They invest in cloud capabilities. They run analytics on top of that. How does that make it difficult to implement AI? None of the programs are connected. What does HHS actually have to do to enable AI as an organization? They have to become a data steward. What are our data sources? What is our data pipeline? What repositories are we going to use to actually house data? We're going to containerize everything because, you know, the basketball hoop needs to be the same height and the three-point line needs to be the same height for every application that's deployed. That way I can compete cloud service providers against one another and drive down costs. And any program can pick the analytics solution that they want. They have to pivot to that model. If they don't pivot to that model, they won't be successful. And having actually done that at scale for the totality of the nation during the pandemic, you know, I think I'm in a pretty good position to actually say, I think I'm in a pretty good position to say that if they don't execute that way, it really doesn't matter what the strategy says.
Do you think they're going to do that?
I think it's going to be tough. I think Clark Minor understands that. I know Kevin Duvall understands that. The hard part is, you know, culture eats strategy for breakfast. And you have a culture that's been built around targeted funding solutions architecture for a number of years. How do you switch it to that enterprise mindset? It's great if you can implement AI in one program, but are you really going to have an impact if you can't see like all the data assets related to a specific chronic condition? Like you guys know this better than I do, and I am not a health professional. But you know this better than I do, but the three largest cost drivers of Medicare, Medicaid for CMS are cardiovascular disease, diabetes, and neuropathy. And in order to be preventative with those issues, you need to be able to access data that's in SAMHSA. You need to be able to access biomedical data that's in NIH. And you can't do that by funding AI that's going to function at the program level. You got to be able to identify the data sources that you need, build a data pipe so that you can access data. Even if you're mirroring it, you can access it in real time across the totality of the department. You have to have standardized containerization layer, repos, and then you got to containerize everything, or else you're not going to be able to implement it. When I read the AI strategy, I did see that vision in terms of the way it was written. Interestingly enough, my initial reaction is it's very much written from a program perspective versus an enterprise perspective. And that makes a lot of sense, right? Because that's the viewpoint that the leaders in HHS see it from. And that's how they've been fundamentally organized for, you know, since its inception.
Well, there's a lot of legal and programmatic barriers to using data across different programs, as you know from your work. And so, you know, you also have to break down those barriers, even if you're able to somehow procure and deploy at a agency level or at a, you know, cross agency level, God forbid, you know, you still have to, there's a lot of work that probably has to happen to break down some of those legal and practical barriers to using data across programs, no?
I agree. Yeah, I mean, look, you need to be able to, and HHS doesn't kind of talk about it this way or think about it this way, but you need to be able to cryptographically wrap a data asset, embed it with a record of integrity, embed it with a set of instructions. It needs to be able to leave its system of origin and carry its integrity and the set of instructions on who can access it with it. Now, you would say, like, does that happen? Yeah, it does happen. I mean, right now, I see that being deployed in the music industry. You're seeing 30,000 pieces of content out of Cannes Film Festival on a platform called TotaQ Micro that are actually fundamentally functioning in that way. ARPA-H is looking at doing tests in that environment. You have to commit to that. I thought your comments on trust and transparency were really interesting. You know, how do you create integrity around a data asset and allow it to leave a system of origin? Because you're never going to force the entirety of the health sector to go to one system and utilize one system to drive, you know, as an example, biomedical breakthroughs in the marketplace. So you have to address that issue. During the pandemic, we did it with granular level access controls. We did it with a technology stack of enterprise platforms that facilitated it at some level. But that's the area where all the innovation has to occur. It's also the area that's furthest behind. And it'll be interesting to see how HHS kind of attacks that challenge set.
Yeah. Yeah. It seems like a monumental task to handle all those different pockets of data, all of which are DURSA differently, right? It's like a lot. But maybe, I mean, it'd be amazing if that all worked out. I'm here for it. I'm here for the vision.
It's being piloted right now with millions of pieces of content in movie and TV, piloted right now in music. I think the health sector won't kind of move in that direction. WellLink actually is kicking the idea of actually doing a pilot with this solution, right? How do you create a secure root of trust in a hardware endpoint so that you can create an integrity wrapper from a data asset that was created off that hardware endpoint and then share it outside the system of record? That's tough. It's not easy.
Yeah.
Somebody's got to try it though. You can't be afraid of it.
Oh, totally agree. What do you think? So, to that point, right? Like, so what I was saying earlier is like, this is like relatively new in the world. The government's big. Things change over every 4 years, if we're lucky 8, right? What do you think about the government, like almost being first to market, almost being like leading edge on AI? Is there a huge risk there?
It's interesting. I guess for a period of time after I left, I evaluated cyber AI and quantum technology for the Secretary of Defense. And I would argue that the government actually is it first from a research perspective in the cutting edge technologies. They're never first in scaling those technical capabilities, right? But they tend to be first, in particular in the DoD sector, at testing.
Oh, yeah.
I think that in the age of AI and cyber and quantum, they are such powerful tools that whatever government in the world is first is the ones that will set the rules of the road to regulate those technologies. They are so powerful that they are not going to be social media platforms. They are going to be shaped by government, and whatever government can provide the most capital, provide the most scalability, provide the guardrails so that it can scale in a way that's a representation of society as a whole. They're gonna kind of win the race. Let's say the AI race. They're gonna win the AI race, and they'll set the guardrails for how that industry works, globally going forward. So it's not a question of will the government be first or not. It's a question of what government will be first when it comes to AI, quantum, and cyber technologies. That's my humble opinion. And look, I'm a capitalist. I grew up in my stepfather ran a mining company. I grew up in a very entrepreneurial environment.
What kind of mining company?
Bluestone. Yeah, I'm from northeastern Pennsylvania.
I was going to say that comes from where I'm from.
That's like,
Douglas,
this is my home.
Yeah,
yeah,
he's like, I know
I'm
where
from Pennsylvania.
I'm from the Lehigh Valley. I know where Bluestone comes from, and I am always surprised that it costs so much.
Northeast, yeah, I'm from Susquehanna County.
Okay, all right.
There you go.
The mighty Susquehanna, love it.
There you go.
Okay, so I'm into that.
Wait, I have a question. This is so I want to know this, Jose, because I was just at the AWS Reinvent conference, and there was a lot of selling to me, and it was mostly successful about the point of transacting on the AWS marketplace and what they're doing right now with public sector. In particular, I sat in on a really interesting thing that was not totally relevant to me about the intelligence community and the AWS marketplace and all the stuff they're doing with military and intelligence. They have like fully private marketplaces now, and they're doing a huge amount of business as far as I can tell. Obviously they were selling, but successfully to me. And one of the arguments they make, and I know you're somebody who you were a core, you were a procurement officer, you did all these kind of different things in procurement in your career in government before. One of the arguments they were really pushing hard is they were like, hey, listen, even governments have, these pre-existing procurement vehicles for cloud. And a lot of the stuff that you can transact on the marketplace can also be on that same procurement vehicle. And that's a huge plus up. They've already made these huge cloud commits, and you can transact on the marketplace and retire it against their existing cloud commit. Thoughts on that? Is that real? How much was AWS selling me?
Yeah, it's interesting. I mean,
this is personal consulting. Just to be clear, keep going.
Yeah, it is interesting, right? The government has set up large scale contracts with cloud providers. I used to run the largest technology contract in the world, at GSA before I was at
NBD, right?
Yeah. So right. So it's really, so how do you set up a contract for cloud, and how do you set it up for a set of services that you can procure? The challenge from so the contracts and the structure exists. The challenge for government is you're not actually able to, you can only obligate funds against a contract if you have funds. Government's funded on an annual basis.
Or not, as the case may be, given our government now.
And so the fundamental challenge is in the way that government is funded.
Right.
Setting it up from a contractual perspective isn't a challenge. You said it on a briefing that was for the intelligence community. The intelligence community tends to get their funding approved for multiple years, and definitely for the whole year, even when the rest of the federal government is on a CR.
Nice.
That's why they're able to behave and scale in that way. Interestingly enough, the Department of War for warfighting activities is funded that way too. That's why it's such a driver of innovation. As I was listening to you guys talking about healthcare, and you guys are incredibly knowledgeable. I was pretty blown away by how much I learned in that.
Lisa's a smart one.
In that period of time.
Sure.
You know, if you categorized some of the health issues themselves the way that you categorized warfighting activities, and you could fund them for multiple years or for the totality of a year, so you could get away from CRs, you could behave in that way. It would drive down costs. It would create a lot of efficiencies. It's interesting that you picked up on that nuance, but it exists, right? It's not hard. There's tons of procurement people that know how to do that at the GSA and even within the federal agencies themselves. It's the funding issue.
You know, it is interesting because I sit in on I believe greatly in our nation's military, and one of the people who works for my consultancy is like her passion project is military mental health, and sits in a lot of briefings where the goal is, how do we make our population more lethal? And, you know, honestly, one way to do that is to make sure everybody is not sick. So like, yeah, I mean, I wonder if there's some way.
It's interesting you brought it up. So I worked with the United States Navy for about 2 years as an SGE when I left government. And I had a couple focus areas: autonomy, robotics, biosurveillance, and mental health, in particular for our Navy professionals. You know, you have to be able to invest in those capabilities to care for your soldiers. Right. And when you look at some of those programs, they're still exchanging, unless they modernized it in the beginning of Trump. You know, when I was there, they're still exchanging data via Excel files.
Sure.
I mean, right. So you're managing the mental health, let's say, of a couple 100,000 Marines, their spouses, it's their dependent children. Longest longitudinal mental health study and largest in the entire world. And you're exchanging data via snail mail. You have servers under desks that are housing the data, and you're kind of moving Excel files back and forth. Like if you want to increase lethality of warfighters, how do you kind of help them manage the pressure of increasing that lethality? And I think it's an incredible opportunity for investment. You know, the Navy secretary that I supported as an SGE carried a card with him, and it had every single soldier under his watch that passed, whether it was suicide, an accident, and it's pretty heartbreaking. They give up so much of their time with their families to protect and support our country. We ought to be overly investing and allowing them to develop understanding. I'll share one other story. I don't think you would mind. So I grew up in this tiny town, dirt road. You know, the way you know it's buck season, if you're not from northeastern Pennsylvania, you see a guy walking up the street with a shotgun with a 30-06 over.
You know, because it's a state holiday. It's a state holiday, first day of deer season.
Schools are off. So anyway, if you're not from there though, that's shock, right? So anyway, an individual that I knew since he was 4 years old joined the Marine Corps. 2 Purple Hearts, IED explosion, 2 comas. Lost functionality of one aspect of his brain. Now imagine he's in perfect shape, like strong, ripped muscles, cannot stand on his left leg and lift his right leg off the ground or he'll fall over. Can't go grocery shopping. You know, if somebody's going to put their life on the line like that, we ought to invest in that. And in his case, they actually rebuilt his brain so that he could deal with some of the stressors that come from having traumatic brain injury at that scale. It requires it requires data sharing. It requires a significant amount of testing. It requires a significant amount of support. And so I think you're right on. I mean, that's where we need to invest if we want to make our warfighter more lethal.
Yeah. Strong agree. And it does seem like HHS is collaborating more extensively, kind of, across different huge departments. I know everybody's been talking about VA.
As an individual that has worked in the intelligence community, and I used to build enrollment, vetting, adjudication, and redress systems to use biographic information to identify terrorists in different domains, and kind of work with law enforcement to remove them from those domains, the systems. Like I used to build the systems for that. The biggest opportunity for competitive advantage is AI and biomedical research. And the most flexibility for those types of activities is in the Department of Defense. It also is a place where there's probably the most need. And there's the only place in the world where you can get access to that type of data and the scientific talent to have that impact is housed in HHS. And so it's awesome to hear that they're collaborating, and I think there's a massive opportunity there for a whole new market. To really, whether it's longevity, increased pain thresholds, build out like fundamental human-based capabilities. It's that partnership.
Very cool.
Well, it's a bit of a, I think because of what you're saying, I feel even more ambivalent and kind of sad about the direction of ARPA-H, because so BARDA exists for a long time doing really interesting biomedical work and funding really cutting edge stuff. And then we had a vision for ARPA-H. Now it seems like the vision for ARPA-H is kind of merging with the vision for BARDA. Are they going to merge them at some point? I think that's a place where this kind of cross-agency innovation could have lived. I don't know what's happening now.
Yeah, I mean, let's talk about ARPA-H for a second. So, you pick up when you leave like a structured environment, like a federal agency, you have freedom and you pick up these things that you can spend time on. WellLink is one of my things that I spend time on for fun. The other thing is I've been working with a group of former congressmen, and we're talking about like, how do we drive more impact out of ARPA-H? And we've been kind of working with the administration on a different approach to doing that. ARPA-H, when it was stood up, I don't know that it had the full impact that it was stood up to have, because they weren't able to get capital out quickly enough to things that would have that would rapidly advance healthcare. And so why not set up a health venture fund? Why not set up a health venture fund? Why not use federal money to seed fund 10 venture capital organizations that are going to put money towards moonshot health investments? And let's just stick with the ones that I mentioned earlier: cardiovascular disease, diabetes, and neuropathy, the three biggest cost drivers. If we can bend the Medicare, Medicaid cost curve, and we can do it through preventative measures, why not take the data sources that are in HHS, make them available in a secure but open environment, so not a single platform, so that venture capital firms can back moonshot activities, focused on those outcomes, and the data is available to those companies at a licensing fee that goes back to HHS, so they can develop the solutions, right? And we've been working on putting that model out there. And I think that's a way to truly make ARPA-H effective. I'm not going to say that ARPA-H, wasn't effective, or it was. I'm going to say that it struggled to kind of get off the ground, and I think have the impact that it was meant to have. And I think there's agreement on that on both sides of the aisle. But anyway, so I do think there's a lot of, and I can connect you with my teammates who we've been working on that together. But I think
they should come on our show.
Yeah, bring them on the show, man.
I'll like them too.
It's interesting though. I mean, I know we're close out of time, and I did want to ask you what you think of TEFCA, having been in that role that you were in at HHS. But with the ARPA-H thing, it's more like, what is the intent, right? Because if you're having investors invest money, even if it's not all theirs, and the intent is to return, that's very different from a moonshot, right? Moonshots are moonshots, right? It's a very small chance that they'll succeed. And so that is a reason that the federal government would invest in them as such. But if we're talking, we just need more high risk investments. That's different. And that as far as I understood ARPA-H was not its intent, but I honestly don't know what the hell its intent is anymore.
Well, I mean, but if let's make up a narrative just to kind of have a little more detailed discussion. So if you took $100 million and you put 10 million into 10 venture funds and you said, hey, look, we want you to raise 20x that number, right? So each venture fund, you're going to raise 20x of private sector capital. And then we want you to focus on areas where you can bend the Medicare Medicaid cost curve in those three categories: cardiovascular disease, neuropathy, and diabetes, and make smart investments. Are they moonshots? Is there a return? I mean, you're licensing data from HHS. You're building
20x is, I mean, as an LP, if my venture funds told me they're going to 20x my investment, that is a dream come true.
Well, but you have federal money behind it, right? If a federal government's going to put in 10, and I don't know what the requirement should be, right? I'm making up a structure. If I'm going to put 10 million into a fund and I'm saying you need to raise 10x the amount I give you, and you need to be committed to going after innovations that can be brought to market in the next 3 years to bend the Medicare Medicaid cost curve, you're banking on healthcare venture capitalists that can actually address those problems. And, you know, you're banking on the fact that 1 in 10 of their investments, or whatever the number is, will be a winner.
Right.
They're not all going to be winners.
Yeah, they're not going to be moonshots, right? They're not going to be transformative, you know, massive.
And I think the idea is a moonshot idea. We have not done that in healthcare, right? We've done that in DoD. And if you look at DoD, they've set up venture funds with that exact structure, and they've had massive impact on warfighting capabilities. Because you had a partnership between the warfighting capabilities and the private sector. They focused resources, capital, and intellectual capacity on problem sets that were their most immediate needs. To me, the moonshot is the organizational model, you know, versus, you know, something more research oriented. I don't know, but I do think, like, whether I'm right or wrong, I mean, it's worthwhile to have that discussion. Yeah. And to drive that discussion, and hopefully somebody pulls it apart and makes something better, because we clearly have a problem that we're not addressing. And, you know, how else do you address it but with a set of ideas?
Right.
And just one other note here, that the Development Finance Corporation, previously OPIC, that we also do this outside of the US. We invest in things we think are going to provide a return to the US, using US venture dollars to invest in other countries in health and other technological innovation. So we have all kinds of things we could use to inform a new strategy or a new way to approach this. And I agree. I think we should do that.
Yeah. Well, Jose, we are over time. You are super fun. We look forward to having you back on with your colleagues to tell us about the future of ARPA-H.
Please do.
Right now, last question.
The future
yes or no?
we hope for. Yeah.
Okay.
The future we hope for.
All right. Sounds good. Last question. Do you love TEFCA? Yes or no?
The concept of it is interesting.
Good answer.
No,
No one ever answers my questions the way I want them to.
It sounds like a gas station. Sunoco, right?
Oh my God. We need
it
someone
like
Slack Max. We need to have a new meme.
Oh my God.
Okay. What do you?
That's good.
What if we renamed it Freedom Health Data Network? Would you be more into it?
How do you feel about it then?
I do like that. And you know what's interesting is when you guys were bantering about TEFCA, what I found fascinating is that in Freedom Health Data Network, by the way, a fantastic name.
Thank you.
We already did the
I named
art.
it.
We already have all of the assets.
I love the name. What I find fascinating about it is you mentioned the part about financing it. If you took all of the data on, I'm making it up, on biomedical research related to pain thresholds, and you made it available in an ecosystem that had TEFCA-like controls in it, and you allowed venture funds to access the data for a licensing fee, you'd be able to fund that underlying infrastructure, wouldn't you?
Oh, yeah. I mean, there's lots of things we could do to make money here. I think we just need to.
And the federal government would get a benefit from that. Yeah.
Yeah.
So that's when you were talking about it. That's what I was saying. I do love the name. When you were talking about it, that's what I was thinking. I was like, you don't have to. It doesn't have to be with one company. it can be a place where access to data is a benefit to multiple companies that are trying to solve some problems. You have to secure it. And that access comes at a licensing fee. That licensing fee goes back to the federal government, and that entity that's outside of the federal government uses a portion of those fees to support its infrastructure. I think you could do that. It's been done in DoD. I think you could do it in the health sector. It requires some vision, definitely a name change. A couple of crazy people with some really good ideas to support it.
Oh, I love a name
Great.
change.
Great.
All right, Jose, we are over, and Lisa and I are both late for an actual real meeting. So thank you.
Thank
You're
you
awesome.
so much,
Totally
Jose. You're
appreciate
awesome.
it.
I had a
Come
lot of
back on
fun.
the show.
Yeah,
We'll talk to you
yeah.
soon.
Anytime. Bye-bye.
Call
All right.
us.
Bye.
I will. Bye-bye.